Ladies and gentlemen, it's a great day today in our Indian medical profession, in fact in a research field, because it's not often you see researchers coming forward to do actually something for perpetuation of the research field. And so fundamentally, first I need to congratulate my colleague, my friend for the last 40 years, Dr. Gopichand Mannam, for starting this, and it's a wonderful effort. Wherever this may lead to, it may be small, it may be big, it's a beginning, that could encourage others to follow suit. There are only a handful of people who knows Gopichand Rao. Ramakrishna is here, Nagarjuna, our chairman, GVS, so closely because we were classmates. I remember during the anatomy days, he used to carry 15 to 20 kilograms of Gray's Anatomy book every day. It's available in the library, but he bought it and he used to carry it all around. That's the kind of commitment that he had. And I remember in our final year or in the house agency, we had a small baby brought in with the heart outside. We call it as external cardia, whatever it is, because there's no sternum. He took a lot of pictures of that, and he's so excited, animated to look at that. Although there was no treatment at that time available, there were only two hospitals in South India at the time. One is in Madras Perambur Railway Hospital, and the other one is CMC Vellore. And in fact, this guy actually got on the train on a holiday during the holidays in our medical school, went to Vellore to see a heart operation in his student days. We were just enjoying ourselves, and this guy has such kind of commitment in those early days. And of course, I've been very fortunate. We were together and we had synergy, so we were able to publish a lot of material from our own experience. It struck me in India there are two or three things, having gone outside and then come back. One is that there is no encouragement for original research, which is absolutely necessary today. What we practice today is preached by the Western society through their own statistics, through the experiences of their clinical work, and then the research on their own population, which is completely different to our population. There aren't many original researches either based in the community or in the hospitals on our own people, except for a handful of publications done around the country. People who are in medical schools or in postgraduate schools, or even after passing out from the colleges into the clinical practice, don't even think as research. It doesn't come natural. People are interested so much of clinical work. We do a lot more clinical work than our counterparts in the West. But there, even during the medical school, people try to publish. Both the professors encourage them to publish, and the students are really keen to publish. They take off 1 year and then do pure research, because that society, that curriculum and the academics encourage that kind of thing. So by the time this guy comes to their post-graduation and this higher specialty, they have skills to do the research, put together a grant application, and there are foundations which give them money to do that kind of research. We don't have any of that. Similarly, once you get into the clinical practice, you're so busy that you don't even learn from your own experience. We did something like 20,000 operations over our group over the last 15 years, and we publish and learn from our own mistakes or our own experience, so that we do better things for our patients every day, every new day. So what I would like, and fundamentally I'm very, very happy today that as a foundation such as this has been started. It's very few in this country. I believe there are only a handful, one in Delhi, one in Chennai, and this is wonderful to see this kind of foundation. But I would, unlike my previous speaker, I would prefer this to start as you already have a platform in the clinical research. So that would be a bigger thing in the foundation to begin with. And the second thing I would aim is to bring in younger people, inculcate the habit of research from the beginning. You can even invite medical school students to begin with. Even start with 2, start with 4. Dr. Pariplavi is here, who works as professor in anatomy. So use this foundation background to encourage or inculcate that habit of doing research in the younger generation. That would be a wonderful thing, because that will become over a period of time an army of researchers. And then whatever interest that they may have in their life, they will take on, and it's just going to be a chain reaction after that. I think in our life, our fundamental aim should be to make as many people as possible to think about research, whether it is clinical research or society-based epidemiological research or innovation of new things. It doesn't matter. As long as you start that small seed of idea in their mind, I think that is, you've done more than anybody in this country. I mean, you would deserve the highest honor if you could do that. So I would encourage you to do that. And with these few words, I'm really honored to be associated with him for these last 40 years, and I don't know how long we're going to be associated life-wise. I'm talking about, not that tomorrow we're going to part. So I really enjoyed working with you, and it's a great honor. Thank you. Congratulations.